a lot of the early research around blood flow restriction training found that we can get significant muscle hypertrophy and strength improvements with it. And the key attractive factor is that we get these at a low exercise intensity. So the way I like to kind of describe it to people is if we think about adaptation, so if we focus on muscle adaptation, so hypertrophy and strength, there's kind of three key factors we can kind of pinpoint for muscle growth. So we've got, metabolic stress as a stimulus. We've got a high degree of mechanical tension, and then some level of mild trauma or damage to the fibers where they then regenerate and we get remodeling and we get hypertrophy. Typically, we know this is maximized with higher intensity exercise. So say 70, 75% 1 rep max or above. And this is what we've seen, like the ACSM recommendations for resistance training. The interesting thing about blood flow restriction exercise, it's inherently low load. So we're looking at around 20 to 30% of 1 rep max, so significantly lower. And we know that level of intensity exercise performed by itself isn't enough to stimulate significant adaptation, at least when it's not performed to concentric failure. However, what we see is that when we perform blood flow restriction during that low intensity exercise, we get muscle hypertrophy and strength improvements, which can be comparable to what we get with high intensity exercise. So obviously that's a very attractive factor about it. If we think about blood flow restriction exercise, it's low load. So that level of mechanical tension is low. There's not a significant degree of mild trauma. So what we think is one of the biggest drivers is the level of metabolic stress that we create in that muscle, in those tissues when doing the exercise, because we make the tissues ischemic and hypoxic, so it creates one hell of an environment within the muscle.